My name is Caleb Corwin. I'm a psychologist here at the Center of Excellence for Children in State Custody. Thanks for joining us for our February Learning Cafe. We do these the third Friday of each month. Today, we are very fortunate to have our own postdoctoral fellow, Christina Beaton, who is joining us today to give us a presentation. She received her doctoral degree from James Madison University in clinical and school psychology. And prior to completing her doctoral degree, she was a middle school counselor in Southwestern Virginia. And it gives her lots of good experience with this topic specifically. She specializes now in working with children and families who've experienced trauma, and she's interested in working with schools and other providers to increase equitable access to mental health services to children in underserved areas. And today, she's going to talk to us about school avoidance, which I think is a topic that anybody working with kids has encountered at some point in their career. So I look forward to it. Thank you so much, Dr. Beaton.
Yeah, thank you, Dr. Corwin. Thanks everyone for coming. I'm really excited to talk with you today. All right, so we are going to talk about addressing school refusal behaviors today. So the takeaways that I want you guys to have from this presentation is first, to really define school refusal as a distinct entity from other terminology that you might have heard or that kind of gets thrown around when kids are absent from school. I also want us to talk about the factors that can interfere with reentry into school with students of all ages to returning to the school building. And then explore interventions from a trauma-informed care lens that can be shared amongst a team of people who are working with students who might be experiencing school refusal behavior. So before we officially begin, I want you to think of a child, bring a child to mind, child, teenager, adolescent to mind. This could be a real child, one that you know, one that you've heard of, or it might be an imagined child. And so I want you to think about when you think of school refusal behaviors, specifically with this child, what is a word or phrase that comes to mind? You can pop it in the chat, or you can unmute yourself and shout it out.
Disrespect.
Disrespect. That's a great word. How come?
Anxiety.
Yes, anxiety. I see in the chat there is how come as a question. Why is this happening? And exhaustion. All really great words. Yeah, so truant, another really good word. And we are going to talk about that word in a second. Well, we're going to confusing. Yeah, those are all great words, and I think all words that are typically associated with school refusal behavior. So, what is school refusal? Because there are a lot of terms that can apply to children who are chronically absent from school. So we are going to characterize school refusal as distinctly different from truancy because there are several important differences. Both are characterized by excessive absences. Typically, truancy is characterized by excessive absences from the school building, from school in general, whereas school refusal might be excessive absences from the school building, but it also might be excessive time out of class. So if you think of those kiddos who are in the bathroom a lot or at the nurse's office a lot, they might be experiencing school refusal behavior. So that is kind of where the similarities end, though. So for school refusal behavior, these behaviors are typically characterized by excessive anxiety and are accompanied by emotional distress, either about school or around attending school or specific situations that occur at school. And for kids who are experiencing school refusal, caregivers are aware that the kids are missing school and they have made reasonable efforts to get the child to go back to school, to get the child to return to school, and the parents know that this is happening. For truancy, the children or adolescents or teenagers are usually attempting to conceal these absences from caregivers. So caregivers might not know that the absences are occurring until they're getting phone calls and letters from school. And it usually is not accompanied by emotional distress. So for children who are experiencing truancy, they're usually not super anxious about the school environment. They're usually not. They might even be feeling positive feelings about missing school, rather than the excessive anxiety that children who experience school refusal are experiencing. Okay. All right, so in the United States, school refusal affects about 2 to 5% of students from kindergarten to 12th grade. So a lot of times when we think of school refusal behavior, I think it's a lot of people think of younger children in elementary school, but school refusal behavior spans all ages of children, kindergarten through 12th grade. And it can look very differently depending on the child. So it could be a few missed classes here and there. It could be some tardiness to school or leaving early from school because of somatic complaints. It might be just a few absences or missed days, but it also can be characterized by chronic absences for weeks or months. So we just knowing that it can look very, very different from child to child. So I think this is important just to keep in mind. In Tennessee, they don't use the term school refusal. They do use the term truancy as a blanket term for all children who are chronically absent from school. And Tennessee describes chronic absenteeism as missing 10% or more of instructional days during the school year. So like I said, they don't distinguish between school refusal and truant behavior. And all students get a truancy plan gets started for all students once they accrue 5 unexcused absences. So the interesting part here is that school districts and even individual schools can define an unexcused absence differently. And so it's really, really important that you are aware of the child that you work with or your own child's school attendance policy, because it might differ from school to school. Even if you have a child that you work with who is in elementary school and one in middle school, those school, but the same districts, those attendance policies might differ. And so some school districts also have differing attendance policies when it comes to parent notes and whether a parent note can be considered an excused or an unexcused absence. So again, it's just important to know what the attendance policy is. And if you, I'm going to say this several times because it's very important, but if you suspect that a child is suffering from school refusal behaviors, then remaining in consistent contact with school personnel is really, really important. Just so the child isn't kind of siloed into a category of truant behavior when it's not truly truant behavior, it's school refusal. Okay, so school refusal behaviors typically begin gradually, though there are some instances where major life changes or disruptions can prompt children to exhibit a drastic increase in school refusal behaviors. So when we're trying to kind of determine or differentiate school refusal behaviors from other behaviors, these are some warning signs to look out for. We want to look for disruptive behaviors in the mornings, some resistance to getting out of bed or getting ready, excessive tardiness and things like that. We want to think about the somatic complaints that they're having, or if they're having frequent visits to the school nurse, absences on significant school days. So if I think of middle school and kind of the terror of having to dress out for PE and what that entails, middle school and high school, or when children start to have to give public speaking presentations. And so absences on significant days of school, clinging and temper tantrums, or elopement from school. If a child is routinely eloping from school or running away from school, that might be a pretty big red flag that they're having some anxiety or school refusal behaviors. So I want to make a caveat though that all of these behaviors, when looked at singularly, we all experience these types of behaviors. We all experience in the morning, we don't want to get out of bed to go to work. at times. We all experience stomach aches and headaches and things like that, or feeling nervous about a significant day at work. So this is not just, we don't want to look at singular behaviors as evidence for school refusal behavior. We want to look at a pattern of behavior that is consistent over time that might point towards a child feeling increased emotional distress at school. So school refusal behaviors can kind of fall into two different camps of behaviors. And typically, these behaviors look very different, but they are rooted in the same thing, and they are rooted in anxiety and avoidance. So that first kind of camp of behavior is anxious behavior. And these are more...
Oh, we lost your audio, but it came back.
Oh, sorry. So anxious behaviors are the behaviors that we normally think of when we think of children who are experiencing emotional distress or having school refusal behaviors. These are more able to, we're probably easier able to identify these behaviors. So these behaviors might look like prolonging or resistance to morning routines, having a lot of ruminative thoughts about specific school assignments, about homework, about important days at school, avoidance of certain classes. So again, when we get to like middle school and high school, when kiddos are spending a lot of time in the bathroom, or if they're going to the nurse's office a lot, or if they're texting and asking to be taken home early for some reason. Somatic complaints, panic attacks that are specifically surrounding school times, or panic attacks at school, and then clinging to caregivers or teachers specifically for our younger children. So these behaviors might be related to school as a whole. So like the concept of school, the thought of school, but they might also, the pattern of behavior might also arise when there are important school days like we talked about, or at different times of the year. So just really getting an understanding of the pattern of behavior is important to inform what the function of the school refusal behavior is. So for school personnel too, it's really important to pick out these patterns of behaviors for students who might be avoiding certain classes or going to nurse at certain times a day. So the other camp of school refusal behavior is disruptive behavior. So these behaviors are defiant, they might look oppositional, and typically children who are experiencing this type of school refusal behavior, these disruptive behaviors, are labeled as misbehaving. Or they might even be, we might put them in the like truancy box because it doesn't seem like anxious behavior. But these behaviors are still rooted in that avoidance of school. So these are temper tantrums. This is the elopement from school, acting out in certain classes, irritability or anger, or inattention and difficulty concentrating. So overall, these behaviors can look very, very different than the kind of anxious category of school refusal behavior, but they are still anxiety-related behaviors. And that is why it is very important that we have a comprehensive and accurate assessment of school refusal behaviors. So when we talk about assessing school refusal behavior, we want to make sure that we're using a team-based approach. And we want to make sure that all of the people involved in this child's educational world are aware of the behaviors and are helping provide information that help to know whether or not this is anxiety about school, this is school refusal behavior. So some of the things that you want to get in an assessment of school refusal behavior with the school refusal team are observations in the school environment. So we want different teacher observations, so they should be in different classes because a child behavior is going to change from class to class depending on their comfortability with the teacher, with the peers in that class, and things like that. This is especially important for high school students and maybe even middle school students who change classes and have different teachers and a different constellation of peers in each class. We also want to interview caregivers of the child, him, her, or themselves, or the teachers. And we're getting different information when we're talking to these people. So for caregivers, we want to make sure we have an understanding of morning routines, if there's been any major disruptions in the caregiving system, in the family system, any major life changes, or any systemic concerns. So we want to know if the child might be worried about what's going on at home or in the home environment. We want to know if the child might be worried about meeting their own or others' basic needs, just to get an understanding of what might be going on at home and what the caregiver is seeing in the home environment. For the child, we really just want to know if they understand their own anxiety related to school. So a lot of kids, if you're talking to them about school refusal, they're not going to be able to pinpoint why they are avoiding school. So we want to assess if they do know why, if there is a specific reason, or if this is a more broader example of anxiety. And then with teachers, we want to know what behaviors are occurring, what are your observations, and what happens before and after a child starts exhibiting anxious or school refusal behaviors. We also want to make sure that we get a good idea of their school history and their medical records. So for school history, we really want to look at how many schools has this kiddo been in. They might have been in one school district, one school their whole lives. They could have been in 15 to 20 different schools, depending on their placement, depending on how much family moves, or if they've moved, if they're in the foster care system, if they've moved a whole bunch there too. We really don't know. So we want to get an idea of their familiarity with school environments just in general, and how many environments have they been exposed to. For medical records, we want to make sure that we can rule out that there's not actually something medical happening, especially with children who are experiencing elevated somatic complaints. So the kids who are going to the nurse's office a lot of the times, or having somatic complaints before and after school, we want to make sure that there's not something actually medically wrong that is like causing them distress. We also want to look at learning difficulties. We want to make sure that children are getting their educational needs met and they are able to access curriculum at a similar level to their peers. Sometimes learning difficulties, if children know that they're struggling at a different level than their peers, can cause a lot of anxiety of like, I'm not able to keep up. I don't understand this like others, and that can lead to school refusal behavior. And then the last one is we want to assess if there's an actual threat at school. We want to be able to say, like, there is not something concrete happening at school that the child is legitimately scared of. So this could be bullying, this could be harassment, or any other form of threat that the child might be experiencing at school. All right, so there are typically 4 functions of school refusal behavior. So we have collected our assessment data. We have, and now we're trying to understand what is the function of the school refusal behavior. So we use that team-based approach of assessment to understand whether the child kind of falls, whether the behaviors fall within these 4 functions. So the first function is to stay away from situations at school that might increase the child's feeling of distress. So this might be related to learning difficulties. It might be related to feeling as if the child can't keep up with schoolwork, or because they have learning differences that haven't been addressed yet. They might also want to stay away from certain people or relational interactions. They might feel anxious in the school environment because of just peers, adults, and feeling anxious about not knowing how to interact in that environment. Or they might want to stay away from certain places at school, like the playground or the lunchroom. I don't know if you have, if you've ever walked into a new school and you're going into the lunchroom, and if your tables aren't assigned, that can be an incredibly anxiety-provoking situation. And so imagine you're a 12-year-old in the midst of all these different hormonal changes, and then you have to walk into a lunchroom environment where it's just very anxiety-provoking. So we want to make sure, or we want to understand if the child is trying to stay away from certain situations at school because those situations are creating distress. The next possible function of school refusal behavior is to avoid evaluative situations, performance anxiety, essentially. So these evaluative situations aren't necessarily related to tests specifically. We're thinking kind of more broadly or outside the box here. So it might be reading out loud in class. Popcorn reading can be really scary, especially if the child hasn't had a lot of exposure to a school environment or has learning differences. Giving presentations, having to change clothes for gym, or being evaluated on their athletic performance in gym. That can be really scary. If you're experiencing weight differences, or if you have any mobility differences, that can be really hard. Or in just any peer evaluative situations can also be another reason for school refusal behavior. So we're looking for if they're trying to stay away from certain situations, or if they're avoiding being evaluated in some way, shape, or form. So the third function of school behavior might be that they're trying to gain increased attention from caregivers or other important people. So I want to make sure that we are all not saying that the child is refusing school for attention. However, the child has an increased need for attention and nurturance from their caregivers or important others. They also might be experiencing separation anxiety. So they might be having a hard time separating from a parent or a situation at home, or feel that a caregiver needs their support. If they know that their caregiver is having a hard time, it might be that school is taking away from their ability to provide support to that caregiver. For children who are in foster care, it might also be difficulty separating from a caregiver due to a fear of not knowing where they're going to go after they return to school. If they feel that their placement is unstable, it might be a fear of an upcoming change. And especially if they have an attachment to that caregiver, that could be a really anxiety-provoking and scary situation. So the fourth function is kind of a secondary function, but still a function in and of itself. So the fourth function is to obtain rewards from staying home. So school refusal behaviors are aversive and difficult to deal with. We all know anxiety is a difficult emotion to feel. It's difficult to deal with. And sometimes letting a child stay at home reinforces that avoidance cycle of behavior. So it might be that the home or a caregiver is a safe place or a safe person for the child. And by school refusing, they're receiving that reinforcement of, I have my caregiver's nurturance, I feel safe, I'm being rewarded. They also might get to play video games when they're at home. So that is another potential reward for staying at home. So it's also important to consider if further assessment is needed to confirm a diagnosis with school refusal behavior. So school refusal is rooted in anxiety, and avoidance is kind of a hallmark of anxiety disorders and trauma disorders. So we want to make sure that we're doing our due diligence and assessing whether or not the child has a diagnosable mental health concern. So the disorders that are typically related to school refusal behavior The ones that are more likely correlated are separation anxiety, generalized anxiety disorder, a social or a specific phobia, major depressive disorder. For children who are in middle school and high school, depressive symptoms and depressive disorder are more highly correlated with school refusal behavior. And then PTSD or trauma and stress related disorder. So it's really important to thoroughly assess children who exhibit school refusal behavior because it can be easier to identify these anxiety related disorders, but we also want to assess those children who are experiencing disruptive behaviors in school refusal so that they're not inaccurately diagnosed with maybe an ODD or an oppositional defiant disorder, because the etiology, the anxiety, is a very different root cause of the school refusal than a child who's exhibiting ODD behaviors. Okay, so I want you to think about your imagined child, a real child that you might know, and think about what barriers might that child and their family be encountering personally or systemically when school refusal is a concern. So what are some potential systemic barriers to them returning to school? And you can unmute and say it out loud, or you can put it in the chat. Transportation and working hours, yes. So meeting those kind of basic needs, and yes, language and culture, absolutely. Not having the right clothes, yes. So being kind of afraid of that evaluation of appearance. Parent working hours, not having a caregiver at home, so not having somebody at home who's regularly able to kind of attend to whether the child is attending school, or the worry that those things can have. Yes, all of those are great. Oh. So we also finally, in this assessment process, we want to assess potential systemic barriers. Yes, lack of support. Assess potential systemic barriers to reentry. So this is, again, a more systemic or broad level look at where these behaviors might be coming from. So we want to pay attention to if the child or if others in the school are experiencing racial or ethnic macro or microaggressions from their peers or from adults at school. We want to look at immigration status, and we want to look at language, the child's ability to access the primary language of the school. When you are going to a school and English in Tennessee is not your primary language and you're being assessed in that language, it is incredibly difficult and frustrating to understand general communication, but also the way that you're being evaluated. So that is a big anxiety-provoking situation. Familiarity with educational environments. So if a child has been to 15, 20 schools, they've had to learn 15, 20 different types of rules and regulations, but also they probably haven't been in those schools for a very long time. So they haven't been able to adjust to the environment that is a public or a private school. There are also children who might have been homeschooled for a long time and not have familiarity with the way that a school day typically runs in a public school setting, or children who just haven't been to school. They haven't had the opportunity to access school. So we want to assess if that is a barrier to them and think about ways that we can help them get more familiar and adjust to that environment. We want to think of a lack of inclusive school climate. So specifically for our children who might identify as LGBTQ, this could be a really huge barrier to re-entry into school if they feel like they aren't accepted, if their correct pronouns aren't used throughout the day, and they are feeling like they constantly have to teach others how to call them, what to call them, and how to address them. And then the last two might be bullying inside of school or cyberbullying outside of school. If a child is feeling threatened at school, that is a big systemic barrier to their reentry. We want a child to be physically and psychologically safe when they are in the school environment. And so we have to assess the barriers that might be impeding their access to the school environment. Okay, so now we know how to assess it. So where do we start in the assessment process? So if you or a child's caregiver or anyone who is in the child's orbit is concerned about their school refusal behavior, it is so important to be proactive and communicate with the school as soon as you can. So by being proactive and communicating, it helps the school get a better understanding of why the kid might be avoiding school. If there isn't communication at the school level, they are likely to say that child's just missing school and avoiding school without having the full information of why this might be happening. So you want to start with contacting someone at the school level to express your concerns and begin the problem-solving process. So I like to talk about identifying champions at school. And anybody that works at the school level can be a champion at school. For younger children, our kids in elementary school, typically that champion is going to be a teacher. It might not be their teacher, but it is a teacher. I think about now that we have and are currently working through life in COVID, then most teachers have Google Voice numbers, or teachers might have like Zoom chats where you can message them, or Google Classrooms where you can message them, and they are they're easier to access, maybe from pre-COVID times. For children in middle school or high school, it might be a teacher that you know, it might be their school counselor, or if there's like a mental health professional in the school that you are connected with, you can reach out to them, or it might be an administrator or an attendance clerk. Whoever you can reach out to in the school environment, who you can identify as a champion within that environment, reach out to them and ask who is the most appropriate person to talk to about the child's attendance and their school refusal behavior. I say all of that, and I'm going to put a very large exclamation on always put all of your requests in writing, especially if you're communicating with the school. We want to document from the very beginning of when we have reached out, who we have reached out to, and how many times we have reached out to however many different people. It is very, very important that you put those requests in writing. So you have reached out to the person or the people, and ideally what happens is, we're going to talk about an ideal world, and then we're going to talk about a non-ideal world. So this is the ideal world situation. Ideally, an interprofessional team of caregivers and all types of different wonderful people is created, and they begin collaborating on a reentry plan from the beginning. So the interprofessional team can include whoever feels most important for you to include on that team. Typically, it is going to include the caregivers, probably a school counselor or a mental health professional in the school environment, the child's teachers, an administrator, and an attendance clerk. But if this interprofessional team is created, we always want to include the people who know the child best and who can speak best to their symptoms. I always advocate for students to be a part of that interprofessional team because they know their emotional world best. They know their behaviors best, and they are able to speak to what is going on for them. So I always advocate for including the student on those teams, especially when important decisions are being made. So again, in an ideal world, this interprofessional team is created, and you just get the ball rolling without having to engage in the special education process. The majority of schools currently use a response to intervention or RTI framework. And so they might have specific intervention teams in place that can address behavioral concerns without pursuing special education services. So when I was a school counselor, I served on an intervention team which would problem solve and collaborate on how to address different behaviors, including school refusal behaviors. In most schools now, Tennessee is an RTI school or an RTI state. And so most schools now use some sort of RTI framework where these intervention teams will already be created. And you can add people to those teams based on the student's needs. However, there are times where that isn't possible, an intervention team doesn't exist, or you might have to go through or request in writing a special education evaluation. So when you would need to do that would be when school refusal behaviors are really, really severe and significantly inhibiting the child's ability to access school. Also, if children start to be penalized for missing school despite a documented impairment in their functioning. So we want to make sure that we're not making school more aversive by punishing children for missing school when they're exhibiting school refusal behavior. If you or your team feels that additional accommodations or modifications are necessary to ensure a student is fully supported in the school environment, then it would be beneficial to request an evaluation for special education services. Oh, and then lastly, if caregivers and providers want a more formalized way that school refusal behaviors are being addressed in the school setting. So you want a way, you want a very specific, detailed plan that where this team meets regularly and is required by law to address these school refusal behaviors, then it might be a good idea to request an evaluation for special education services. So we're not going to go into 504s and IEPs for this evaluation for this presentation, because that could be 4 different presentations. However, a 504 is for students who have a documented disability. It can be any disability that impairs their functioning and inhibits their ability to access the education at the same level as their average peers. So the 504 plan doesn't add anything additional, but it does decrease the barriers that a child might be experiencing. So one barrier a child with school refusal behavior might be experiencing is an attendance policy. And so if we need to change that attendance policy for that child, a 504 plan would be the way to go with that. An IEP is more specific, has more rules around it. And so if a child needs additional supports in the school environment, that is when an IEP might be more beneficial. But the school determines whether a child meets the criteria for a 504 IEP, and you would have to request in writing an evaluation for any type of special education services. Okay, so we have our team. And we have done our assessment of school refusal behaviors. Now we want to start from the very beginning and create a progressive reentry plan. So a reentry plan, a good reentry plan, is going to include goals for reentry and when those goals are going to happen. When do we want to meet those goals? So goals, if you're an educational professional, and maybe a lot of other different types of professionals now, you know what a SMART goal is. And so we want to essentially create SMART goals, specific, measurable, achievable goals for children to be able to successfully re-enter into the school environment. So we want them to be progressive, where we should not expect a child who is not attending school at all to re-enter school the very next day once we determine that school refusal behaviors are happening. We need it to be realistic and we want it to be progressive. And we want it to have a specific time frame. So we want any plan to say this child should be working, this child and the team should be working to meet these goals within 3 to 4 weeks. We might set a goal that they will attend classes for half of the school day in 3 weeks' time. Or we might set a goal that a child can complete their work in the front office. If they are having a really hard time in the classroom, let's at least get them into the school building and complete their work in the front office. So we want to make sure that the plan is progressive, has a time frame, and everybody is consistently implementing the plan. So reentry plan should also include who is helping the child work toward the goals and ways that the goals are going to be met and who is working on them. So we want to ask questions like, what treatment is necessary to help this child re-enter into the school building and re-engage with educational curriculum? What accommodations or modifications can be given to the child to help them feel more comfortable? Who are the identified safe people at school for the kid to help with any difficult behaviors? And what supports does the child require to make school a physically and psychologically safe space for them? So this, I think reentry plans are fun to make because you can get really creative in the ways that we make these accommodations and modifications to help children re-enter into school. And if a child, I think about like a kid who is in high school and they are refusing school, but they love art. So the art teacher might be their safe person. And one of the goals might be having the child come to an after-school club in art with that art teacher. So they're getting positive exposure to the school building in a gradual way, which allows them then to re-enter into the school building during general education curriculum. So this is where I like to kind of tell a story about how we had to get really creative with re-entry plans. When I had a child who was experiencing school refusal behavior, I was a middle school counselor who had a student who was exhibiting school refusal behaviors related to a fear of him or his parents becoming ill. So he was receiving outside treatment for an anxiety disorder. And we also made a reentry plan at the school level that helped him remain more consistently in the classroom. So he would come to school, but he would frequently leave the class and either go to the nurse's office, the bathroom, or my office. And so that plan we created, we brainstormed with the student a list of people who were safe to him in the school environment. And we would rotate who that person was and who would walk with him to class and sit in the classroom with him until he had used his coping skills. So he would walk to that person in the morning. That person would practice his identified coping skill of the day with him. And then we would walk with him to the classroom and sit with him in the classroom until he had practiced that coping skill in the classroom. He had a little post-it note that he would put at the top of his desk to let us know, I am okay. I am at a tolerable distress level. He is not going to not feel distress, but he can tolerate his distress, and the adult would quietly leave the room. Now, the other children in the classroom and the teacher knew that this was happening, so they didn't pay attention to whoever the adult was in the classroom. They just kind of let that person be there and then leave. And that really helped this child to feel more comfortable and supported in the school environment so that he could remain in the classroom for longer. Okay, so evidence-based approaches to treatment for school refusal behavior. The first and most important thing is having some sort of exposure therapy included into treatment. Exposure therapy might be the treatment in and of itself, or it can be included in other types of treatment the child might be receiving. So CBT is another supported approach for school refusal behavior, but it always includes an exposure therapy component to it. Because again, the root of school refusal behavior is anxiety and avoidance. And we want to increase the child's ability to get back into the school and approach it. So other helpful components that are important to include in treatment are relaxation training, which if you're doing exposure therapy, you should also be doing relaxation training. Those things go hand in hand. Social skills training and addressing concerns with separation anxiety. So again, school refusal behavior does require a team approach. So we're also going to talk about supportive strategies for caregivers and educational professionals so that they can be involved in the child's treatment. Okay, so exposure therapy involves systematic desensitization to a fearful aversive stimuli. So for the child, it is going to likely be school or some aspect of school. It could be a certain class, it could be peers, it could be the gym or a location at school, but we are systematically desensitizing children to whatever their fearful stimuli is at school. And it helps them understand and confront their fears in a gradual way. So again, we don't want a child to go from no school attendance to full day of school attendance because that's going to be too aversive and too much. We are going to create a hierarchy of tolerance for the child to be able to work their way up the hierarchy. There is a heavy caregiver, homework, school component to exposure therapy. So we, the caregivers, a lot of the therapy typically happens outside of the therapy room. And so the caregivers have to be really supportive and able to kind of handle the child's disruptive behaviors, which might occur when you're doing exposure therapy. The caregivers and educational professionals will have to aid the child in using the coping skills that they learn in order to work up their fear hierarchy. And the kid and the parents are going to have to complete homework. So practicing those relaxation skills, getting closer and closer and closer to moving towards being back in the school building. So cognitive behavioral therapy is also an evidence-based practice that can be utilized to address school refusal behavior, again, including an exposure therapy component or an in vivo exposure component. So with CBT, we are looking to understand the student's thoughts, emotions, physiological sensations, and behaviors that are impacting his or her school refusal. And we want to modify any negative thoughts that the child has about their self in school and about the school itself. For children with histories of trauma, we want to make sure that that in vivo exposure component related to school is prioritized at the beginning of their treatment because we want them to be back in school while they're also undergoing trauma treatment. So we want to just really understand the child's emotions. They might be feeling anxiety and having a stomach ache. We want to look at what thoughts they're having regarding themselves and others or academic content. And we want to understand what the behavior is. And if we can change one thing on that triangle, then it is very likely that the other things will change as well, or at least shift a little bit. So relaxation training, again, typically goes hand in hand with exposure therapy. As you are completing exposure therapy, you are also practicing coping skills to help you bring your level of distress down with each step of the hierarchy. So practicing relaxation training skills at home, school, and in community environments really helps the student be able to access and use them more effectively. So not only do we want to practice them at school and at home, but we want to practice them in either when the child is either feeling positively or neutrally, so that they are getting access to those skills when they're feeling good and are better able to access and remember what those skills are when they are in a distressing situation. We don't have, children especially, don't have full access to their frontal lobe when they are experiencing a high level of distress. And so we want them to be able to easily remember and access those skills. And in order to do that, they have to practice them when they're feeling good. So relaxation training can be as simple as making sure that they understand deep breathing. So using belly breathing, square breathing, any of the mindfulness breathing techniques. With younger children, it's really good to use metaphor when we're teaching, when we are teaching relaxation training or deep breathing. So pretending like you're blowing a bubble and you want to blow the bubble as big as you can, and breathing really slowly out to extend the exhales longer than the inhales. Or doing hot chocolate breathing, which I love, primarily because sometimes you can really make hot chocolate to practice hot chocolate breathing, and it's really fun. And then you also get to drink hot chocolate, which is a win. We're always trying, yeah, it's a really big win-win. So doing hot chocolate breathing. For older children, teenagers, you can do progressive muscle relaxation to really help them kind of understand the physiological sensations they have and being able to decrease the physiological distress that they might be in. And then for like middle to high school students, I think we all know that most kids nowadays are very technologically savvy and really into apps and all of the things. And so I think apps can be a really good supplement. It does not replace person-to-person relaxation training, but they can be a really great supplement to relaxation training. So the Calm app, Insight Timer, and Mind Shift are all meditation apps. And then the Finch app is a really fun self-care app that is a game where you create your own Finch, and then the Finch leads you through guided meditations or movements and things like that. Really fun app. I think adults should check it out. So just that's my that's my advertisement. Not affiliated with the Finch app in any way. So next, we might want to consider social skills training, especially when the function of school refusal behavior is anxiety surrounding crowded areas, other children at school. Social skills training might be a good intervention to implement. So social skills training often happens in group settings. So again, with exposure therapy, any gradual exposure that we can get the child to not feel significant distress in is really important. So a group setting of where all of the children or a mixed variety of children are learning social skills can help the child get increased exposure to a group. Or if the social skills groups can be led in a classroom, we're getting double exposure to other children and to the classroom. So depending on what the child needs, you can cater the social skills training accordingly. So you can help teach children to role play different situations that might be socially aversive to them. You can help them learn reciprocal conversation. For a child who hasn't had a lot of social experience, that can be really, really difficult. Teaching them sharing, or for a child who has a fear of asking for help in the classroom, or for a child who might have learning differences that they're very self-conscious of, teaching them self-advocacy skills can be super important so that they feel more confident and know that they're not alone in needing to ask for help. So we want to address any separation anxiety with caregivers if that is present, creating morning and night rituals and hello and goodbye routines. These two books, The Kissing Hand and The Invisible String, are great for addressing separation anxiety. And then we want to make sure that caregivers and educational professionals also have strategies that they are using to address school refusal behavior. So again, creating consistent routines, providing encouragement and validation, and standing firm when reentry plans are in place. And then similarly for educational professionals, we want to find a positive and safe person at the school for the child to go to if necessary. Maybe the child participates in check-in, check-out, which is another great program for children where they have a supportive person identified and they see them at the beginning and end of every day. And then these are some additional resources. So there's the School Avoidance Alliance is a really great resource for both parents and educators on school refusal behavior and interventions. And then Tennessee STEP is a specifically Tennessee organization who helps advocate or can provide assistance if special education services or advocacy within school environments is necessary. So thank you all so much for listening. I know we're almost at time, and so if you have any questions, drop them in the chat or ask them. And yeah, thank you so much for being here.
Hi, Ms. Beaton. I do have a question. I've been working with a child for, well, since the pandemic, with extreme school refusal behaviors. He's changed schools twice. And again, I can see some of the steps of this. Wish I had known about this a long time ago, where they've been trying to kind of scaffold. I'm not familiar with, at the outpatient level, it's very difficult to get involved to the level that's needed here. But I know one of the things that mom struggles with is, I mean, this kid would again start to fight to the point where he eloped from school running after the car down the road.
Yep.
And again, often when it began, mom's frustration was that when the child was having a problem, the school would call mom and say, come get him. And that just reinforced these school refusal behaviors. And so here we are 2.5 years later with some help from Homebound, but not what the kid needs. And the mom is a single mom, primary caregiver for other younger children. And so she can't individually provide all of this. And there's very little support. So I want to know how to help this family. It seems like they've been trying exposure, but it isn't consistent. Nothing is consistent.
Yes, and consistency is key here. One resource that you might use is the Homebound teacher. There have been instances where I've had a child who exhibits school refusal behavior, and we have had the Homebound teacher bring the kid after school to the school building to do the Homebound work. Or they might do Homebound work in the library during the school day. So just any kind of gradual exposure that the child can have. And if the Homebound teacher has the flexibility to do that, it can be really helpful in addressing some of those avoidance behaviors that he's exhibiting, while also kind of staying with a safe person in the school environment.
Yeah, even 3 years into it, this child was assessed as having very low fluid reasoning skills. And I will get 1 or 2 word answers even after working with him regularly for 3 years. So being able to assess his internal experience and build that communication has been really difficult.
Absolutely. Yeah.
So assessment. Do you have a specific assessment that you recommend using, or is it more of a general psychosocial?
I would say normally a general psychosocial. On that School Alliance website, there is an assessment but I have not evaluated or looked at the assessment or how the assessment was created. So I can't speak to its who it was normed on or the demographics or anything like that, but there is an assessment on that School Alliance website.
All right, thank you.
That I think is free. Yeah, thank you for your question.
Well, I wanted to take a minute and interrupt me if anybody has other questions, but thank you so much, Dr. Beaton, for presenting on this. I think, I think clearly so many people are interested in the topic. I know, it's hard to work with kids and not encounter this issue, and so this information is so incredibly relevant. So I really appreciate you taking the time to put this together and present this for everyone. I want to also give everybody a reminder that there's a link in the chat to the survey. So please take a minute and click on that link and fill out that survey. It does 2 things. First, it'll get you access to your certificate. Second, it gives us feedback on how we're doing, and we're always looking at that. If in there you have ideas for other topics we could present that would be relevant to the work you're doing, working with kids, specifically kids in or at risk of being in state custody, please give us those suggestions. Also, if you know of an agency out there that provides a relevant service, something we could hear more about, that kind of leads me to next month. Well, next month, we're not having our learning cafe. It's spring break, so we won't meet in March. But then in April, we'll be having our learning cafe, and we're going to have Crystal Crawford come and join us and talk to us about Parents as Teachers, which is a home visiting program for Knox County, which is a phenomenal program for mothers and young children under 5. And so I hope you will come back and join us for that. Thank you again, Dr. Beaton. Appreciate it.